Now, we are all hoping to move down to lockdown level 3 come the 1st of June. One of the measures could be that if infections are limited to 10 or less than 10 per 100,000 people in any given area, that you're safe to move down to level 3. But of course that depends on doing enough tests, and testing is another issue. So let's explore the challenges and possibilities with the system, and I'm joined now by Dr. Kerrin Begg. She's of course a public health medicine specialist. She's with the University of Cape Town. She's also part of the COVID-19 guidance task team. Good evening, Doc. Thank you very much for joining us. Even in well-resourced countries like the United Kingdom and in the USA, people were not all tested. In fact, people who suspected they might be sick just simply stayed at home. So here in South Africa, what are the recommendations on who should get a test and when?
So let's start with some of the challenges around some of the testing that we've done to date. What we have been seeing since the start of our epidemic at the beginning of March is around about a consistent 3% case detection rate. In other words, out of every 100 tests we do, we get about 3 positive cases. There's been an interesting development over the past 3 to 4 weeks, where we've been seeing a rapid number of cases being detected in the Western Cape. And initially, so the interpretation could be is that because there are indeed many more cases, and the Western Cape is what's been called an epicenter. But in fact, if you start to unpack a little bit about the testing, you'll note that for Western Cape has actually now ramped up simply in the last 2 weeks to a 14 to 15% case detection rate. That means out of every 100 tests done, they are detecting 15 cases. If you take the rest of the country without the Western Cape, they've actually dropped down to a 1.7% case detection rate. That means out of every 100 tests, we're only detecting between 1 to 2 cases. Now, that's obviously very worrying when we have limited resources in testing. And that's not purely a South African issue. That's an issue relating to the pandemic itself. We just simply can't keep up supply versus demand. That means we need to think carefully about how we test, about our strategy for testing, so that we detect those who are indeed positive and don't waste tests unnecessarily on those who are negative. So one of the challenges is around our mass screening program that we started just as we were entering lockdown. And that's been a challenge in the rest of the country and has indeed contributed to the lower case detection rate. Whereas in the Western Cape, it's been far more strategic in terms of that screening program. Firstly, focusing on hotspots in areas, but also focusing in clusters, which are predominantly workplace-based clusters. So when more than 1 case or 2 to 3 cases are detected in a workplace, then there's a very strategic attempt to get in and try and find all the possible cases. So essentially what this means is that we are probably significantly, we are under-detecting cases around the country, and probably more so in the rest of the country than we are in the Western Cape.
Now, maths is certainly not my strong point, but my understanding is that once you reach a certain level, you could be then made to stay in a higher lockdown level. That suggests to me there's 2 problems with that, potentially. One is that there's a disincentive to show more active cases, which might mean that there's a disinclination to do those tests. But secondly, there aren't enough tests anyway. Now, in Johannesburg, according to my maths, we need anything more than 500 active cases would suggest that we are over the 10 per 100,000 estimate. So that would suggest that we would have to stay. According to what I've been seeing of the latest stats, we're at about 203, which would suggest Johannesburg shouldn't be penalised and stay on lockdown level 4. But exactly what you're saying, if there aren't enough tests, we can't get to that number. We can't really assess where we're going. So how good a measure is it for deciding when to move through a lockdown?
Well, so I think that more importantly than battling with those issues is really around understanding the dynamics of the epidemic in the moment. And right now, our testing, first of all, the numbers are completely inaccurate. We have massive backlogs at the laboratories with testing. So that means that there are, so over the last 2 weeks, we know that there's somewhere between, depending on the city, between 15,000 and 5,000 backlog in tests. And if you take that case detection rate, there could be a number of thousands of additional cases that we're simply not testing because of a backlog in testing, never mind that we're testing the right people. So that's the first thing, is we need to clear the backlog. And part of the backlog is related to kits and reagents that we simply are struggling to get in the country because of an international competition internationally with in terms of resources. We're also sitting at the bottom end of Africa, and already there's a travel ban, so getting kits here is quite tricky in terms of getting those testing kits. So it's really important for us to be strategic at who we're testing. But you're quite right, there's also, in a sense, a disincentive to test and detect cases because it impacts the economy, both in terms of who's actually sick, but also in terms of hiding who's sick so that you can open up the economy. So, there are always political ramifications and decisions that come into play in public health. So the important thing is that, A, we need to make sure that we maximize the usage of tests, that we also look at producing our own reagents and kits in South Africa so that we're not dependent on the international market. We need to think carefully about our mass screening and testing program and rather look at targeted testing. And then to also review some of the other aspects. For instance, in Johannesburg, there's a significant amount of testing going on in Gauteng. 1.2 million, 127,000 tests alone in Gauteng. But the reality is that the detection rate is not particularly high. And we know that there are things like baseline testing before workers return to work. And that is absolutely useless because they may well be negative today when they return to work. But it's a complete waste of a test because it's not linked to any probative or predictive value as to whether that person is going to be positive or not. So we really need to be a lot more strategic in the way that we test. If we look at the numbers and we work backwards from deaths, so currently today our deaths are sitting at 238. We know that from the world's wide data that we have around about a 1% case fatality rate. So if we look at that, we're actually saying that based on symptomatic cases, we should be seeing around 23,800 cases in the country right now, and we're seeing half of that. So even based on just our death data, we know that we are under-detecting by 50%. If we further look at that we have asymptomatic cases somewhere between 50 and 75%, at the absolute minimum, we are sitting with somewhere around 50,000 cases in the country right now, and yet we're only detecting around 12,000. So, we really need to be making sure that we are finding those cases, really importantly, testing, quarantining, isolating the cases, quarantining their contacts to make sure that we stop the spread. It's really important to detect cases as early and as swiftly and efficiently as possible.
Thank you so much for those insights. Really appreciate it. Dr. Kerrin Begg from the University of Cape Town. She's a public health specialist.